So for this first one, could I ask the following folks from Cleveland EMS to come up? Sandra Davis and Ronald Hayden, if you are here. And then from Cleveland Fire Department, Captain Patrick Cannon, firefighter Michael Dalton, firefighter Michael Grasson, and firefighter Jeffrey Maddock. And we'll have to kind of evenly split. It's getting a little crowded. I think it's also important to point out that there are usually a lot of people involved in these cases. There may be other responders on the scene that didn't happen to get recognized. It's not intentional. There are dispatchers that were critical in taking care of and making this work. Because if you don't get the story right and you don't get the address right, this isn't going to happen. You're not going to be up here talking about how the patient did well. But anyway, on August 24, 2009, Cleveland Fire and EMS units were dispatched to the scene of a reported shooting. When they arrived on the scene, they found a 14-year-old boy laying in a pool of his own blood on the sidewalk. He had a gunshot wound to his neck with obvious signs of shock and was unable to move his arms or his legs. Cleveland Fire units arrived on scene first and began care, with EMS arriving shortly afterwards. Working together, they immobilized the patient, administered initial stabilizing care, and left the scene within a span of 5 minutes. During the trip to MetroHealth, they had to assist the patient's breathing due to his worsening airway compromise from the gunshot injury. Upon arrival at MetroHealth, the patient required emergency surgery to repair a transected carotid artery. So the blood vessel that goes up into your brain supplies half the blood was completely sliced. So that's a lot of blood pouring out on the sidewalk every second. He was also found to have a spinal cord injury at his first thoracic vertebrae level. He remained in the hospital for approximately 3 weeks before going to the Spinal Cord Rehabilitation Center at MetroHealth. He still has a long road ahead of him to this day, but he has shown meaningful improvement from his function after hospital discharge. If not for the quick actions and teamwork of all the responders involved that day, he would have probably died in a pool of his own blood on that sidewalk. Please join me in recognizing these individuals for their actions on that day.